Hey everyone, it's Ed, and welcome to another edition of Ed Talks. And really excited about this one because it's on one of my all-time favorite topics, something that's very near and dear to me, and that's around patient experience. And I have my friend Brian Carlson with me. Brian, welcome to Ed Talks.
Good morning. Hello, Ed. It's good to be here.
Yeah, Brian, you and I only met recently, and it's funny, right? Because we've both been in the industry for a while, and we're both sort of in the same space. But I've seen your work, and you've shared more with me, and I'm super impressed. But before we jump into that, tell us a little bit about yourself, because I think you have a very unique background.
Yeah, thank you. So I currently serve as Vice President of Patient Experience for Vanderbilt University Medical Center in Nashville. My career, though, has really been in hospital administration, but specifically group practice administration. So I started at Northwestern, was the practice manager for women's at Northwestern for a couple of years, and then I went to be COO and then CEO of a private group of multi-specialty doctors in New York State, and then moved to Nashville in 2007 to be the administrator for ophthalmology. Did that for 5 or 6 years and then moved to the system level role over patient experience about 10 years ago. So I was a administrative leader with one of the metrics being patient experience, and was consuming the input. And now I'm on the other side where I'm bringing leaders along to understand what patient experience is, the value of it, the importance of it, and how to improve it.
Yeah, no, that's great. I love it when people in the profession come from operations because you really understand all the nuances of patient experience. It's not just the clinician, although obviously clearly important, and it's really more holistic. And so you bring that perspective. So one of the things that you shared with me that I found truly fascinating was exceptional Joe. But tell me in general, share with us in general a little bit about how you approach patient experience. And then I do want to go into that example because I think it's so cool.
Yeah, absolutely. Well, first, broadly speaking, patient experience, I think the Barrel Institute has the right definition for patient experience, and it's essentially the sum of all interactions. So it's
Yeah.
not one thing, it's the sum of everything that we encounter. And we come from so many different perspectives. What are we walking in with? Have expectations been set? Are we afraid? But what I find, what most patients remember is the interactions. It's how we made them feel. So
Yeah.
process plays into that as well, but it's really, how we make them feel. But that making how we make them feel is really on the workforce engagement side. So, the tight interlinking of workforce engagement and patient experience is so intertwined. And I firmly believe if you want to improve a patient experience, you need to start in workforce experience, because if you're giving the workforce the tools to do their job, by nature, they're going to know what to do and want to deliver good quality, exceptional, good experienced healthcare. It's just sometimes we get in our own way, and healthcare can be pretty tedious.
Yeah. I love that line of thinking because that's why, Brian, I wanted to have you on because not many people are there. Not that they're against that line of thinking, they just haven't thought it through. But you're
Yeah,
absolutely right that it's the workforce engagement that leads there into the whole patient experience because you could have all the right programs, everything, and if your workforce isn't there, then it's not going to happen. So
yeah.
you do this very unique thing, and so please share with the audience what you do with Exceptional Joe.
Yeah, so Exceptional Joe is a fictional character. We created the character in Vanderbilt about 6 or 7 years ago. That was a result of a culture campaign that we've been on. So, I've been one of the co-leaders of that since its inception, called First Defining Personalized Care and Now Making Healthcare Personal. And essentially, what it is we are continually reteaching the organization about our culture and our values. In our case, our credo and our patient and family promise. Those are our core items here at Vanderbilt. So we started a campaign about 7 years ago to reteach that. We created this character called Exceptional Joe. Well, then, one of the things that being coming from operations, I realized is we tend to focus on what's not going well, the problems,
Yeah.
and we're using those problems to continually train. Don't do this, don't do this, don't do this. But there's a flip side to that. And that is, we do far, far, far more right in healthcare than we do wrong. And our patients tell us that as well. We do a lot of things right. So the line of thinking is, rather than focusing on what's not working well, let's enhance what's doing well. And the human behavior could attract itself to, wow, I want to get that recognition. I want to feel good that way. So my behavior is going to start to go in the direction of what works well versus what doesn't work well and is being corrected. So about right before COVID, actually, came up with an idea. And the idea is simply this. We know that in patient experience surveys, patient experience feedback, and I'm going to talk specifically about Vanderbilt, but I know many peers
Yeah.
are the same. We get lots of comments. Our patients are very generous in giving us sorry about that, in
No
giving us
worries.
feedback, um, and they'll go to great extents to give comments to us, and in those comments they'll even go to the degree of saying, Ed was a great nurse. He really took exceptional care of me. And they'll write it in the survey. It'll come back via our partners in the portals. But historically, what that requires someone going in and reading the comments. One, reading the comments, but then two, making a connection. Oh yeah, Ed the nurse. I know who that is. Okay, paste, copy, put an email. Send it
Yeah.
on. You flick it on. I mean, there's a lot of steps to that. And middle management in healthcare is by far the hardest position in healthcare. No question. There's not a lot of time to do that. So we know that at Vanderbilt, we get about 250,000 comments a year. 80+% of those are positive in nature. About 20% of that 80%, a name is left in that. So how could we create an easy way to identify the names or identify who was being said in those comments and send those to them automatically versus a manual process? So we worked with a professor in bioinformatics, and we created a matching algorithm that we pull the comments from our portal. We identify the names. We then have an HR file that's uploaded to it as well. We then go into the electronic health record and look to see who has accessed that patient's record. So what are the names of security-wise who's accessed? We then do a match to say, Ed was in this comment, the patient was on said unit, this nurse was on said unit as well, we have a match. And we
Brilliant.
load those matches up into a portal. We then have someone review them to make sure, that looks correct. And then we click send and we send them on. And today we started this right before COVID, like I said. We've now sent out over 80,000 comments to workforce members across the organization, not just in the hospital. And the beauty of it is yes, the vast majority are physicians and nurses, but there's also ancillary staff that are frequently named.
Yeah.
And they never hear anything. So we've had front desk staff get comments left. We've had billing staff get comments left about that. And we can do that match through who's accessed that patient's record.
That's so important. That's why it just makes me smile and kind of makes every once in a while I'm like, man, I wish I was there, a part of that work. Because Brian, that is amazing. Because like you said, most of the time it's sort of punitive. We get the negative comments, which are helpful, and we make changes. We don't do this, don't do that. But you're also taking the vast majority, which are positive, and making sure people know because they don't know. And I know, Brian, because you've worked so long on the operational administrative leadership side, you know that frontline workers, especially, they don't get praised often enough. And that's where the rubber meets the road. And you all have found a way using tech to get to that. And I know because I've, like you, I spend a lot of time with frontline staff. And I know how important that is because that's the feedback they would give me whenever I rounded with them and what have you, is they love to know when they're doing well and to be recognized as such, because that's just our human nature. So man, that's awesome.
Let me also just add, so when we send the email, it comes from Exceptional Joe, who's this fictional character. It comes from an email box called Exceptional Joe. We have the comment in there. This patient sent this, left this for you. Keep up the great work. But then we also have a red cap survey attached to it where we said, if you have anything, just give us feedback. And it really was one question is, how did this make you feel? And, of course, we've gotten several hundred of those returned. It's not required, several hundred returned. And the vast majority, there's a few that are not positive, but, we'll put those to the side. The vast 98% are positive in nature, but they also have an open text box. And Ed, I will tell you, some of the comments, like I'm not going to, this is, not word for word, but there's been comments that we've read where like, you know what, I was having the toughest day. I was
Mm,
questioning, do I want to stay in healthcare? And then I came home and read this comment, and it reminded me of why I do what I do. Thank you.
yeah.
Keep doing this. And if only one of those, this program was a success. Just one. And we've had multiple of those to show the impact.
Wow. I love it. Brian, thank you so much for sharing and doing the great work that you're doing for your community and the patients. I have family in Nashville, so I'm all about Vandy and the great work of your organization and helping patients and others. So thank you so
Yeah.
much for being on the program.
Thank you very much, Ed.